If you've been dealing with neck pain for a while and you've been told everything looks normal, this video is for you. And a lot of people in the Louisville, Colorado area and really across Boulder and the Denver metro area are walking around with reoccurring neck pain that never seems to fully go away. Or maybe it comes and goes, maybe it just flares up after a bad night's sleep or after work, after stress, after being on the computer for too long. Or maybe it just feels like your neck is always stiff, irritated, and really easy to aggravate. The most frustrating part about this is a lot of people have been told that there's nothing serious going on. Nothing showed up. Their tests are normal. Their imaging looked normal. And nothing was revealed. There's just essentially recommendation that's very general to stretch more, to rest, to improve your posture, and just manage it. And while some of that advice may be helpful, it still leaves a lot of people asking the same question. Why does my neck still hurt? And that's an important question because there's a big difference between nothing dangerous showing up and your neck actually functioning the way it should. Those are not the same thing. In many cases, imaging is very helpful for ruling out major pathology, things like cancer, infection, fractures, and that matters. But the imaging doesn't always explain why someone continues to have reoccurring neck pain, stiffness, reduced mobility, tension, and just ongoing irritation. And it doesn't really show us how the body is compensating or explaining why you're always stuck in these chronic postural stress patterns. And it doesn't always reveal the functional patterns that it may be contributing to why the problem keeps coming back. And that's where a lot of people just get stuck. They know something feels off, but they've not gotten any clear explanation that actually makes sense. At our office, we see a lot of people from the surrounding area of Louisville, Boulder, Lafayette, Superior, the whole greater Denver metro area, and even from across Colorado who are really dealing with this exact pattern. They've tried stretching, they've tried massage, sometimes they've tried physical therapy, medication, or even traditional or generalized chiropractic approaches. And often they get temporary relief, but it's not consistent, and the neck pain keeps coming back. When that happens, it usually suggests that there may be a deeper mechanical or structural pattern that has not been properly addressed. That is one of the reasons in our office we take a more measured and specific approach. We're not trying to chase symptoms blindly. Yeah, we help people feel better, but we really look at what's the root cause of the issue. We're trying to understand why the neck keeps getting overloaded in the first place. We look at posture, we look at structural patterns, we look at how the upper neck may be influencing the rest of the spine and the nervous system. And that's when we use 3D imaging to better understand what's going on with your alignment. So your recommendations are based on your unique misalignment, also known as a subluxation, and how to specifically address that without just generalized guesswork. Because reoccurring neck pain is often more than just the spot that hurts, right? Sometimes people have pain down here and the problem is up here. It may involve long-term compensation patterns. It may involve how your head and neck are positioned over time. And it may involve chronic tension patterns that keep putting stress into the same tissues again and again. This means not every case in our office is identical. It does not mean that there's one simple solution for everyone. But it does mean that chronic and reoccurring neck pain deserves a more thoughtful evaluation, especially when it keeps affecting your life. If your neck pain is affecting your sleep, your focus, your workouts, your patience, your workday, or just your ability to feel normal in your body, that matters. You shouldn't have to keep normalizing it. You also should not have to keep settling for vague answers that do not really explain why it keeps happening. At Koru Chiropractic Care here in Louisville, Colorado, we specialize in a gentle and precise neurologically based approach designed to look deeper and create more clarity. Our goal is not hype. Our goal is not overpromising. Our goal is to understand the pattern and to measure what we can and to help people determine whether there's a better path forward. This is why we say we measure or we test, we don't guess. So if you're in Louisville, Colorado, or the greater Denver metro area, and you've been dealing with reoccurring neck pain, even though everything supposedly looks normal, it may not mean nothing is wrong. It may mean you just haven't taken the right look. If that sounds like you, and you're looking for a gentle, root cause based approach, our office would be happy to help you figure out whether you are the right fit for our approach in helping people with neck pain. I'm Dr. Norris, and I'm the clinical director here at Koru Chiropractic Corrective Care in Louisville, Colorado, and thanks for watching.